Welcome back to day 3 of ACC 12. So continuing with late-breaking clinical trials, Deepak, there was a very interesting one called EINSTEIN, I think. Tell me a little bit about that.
Absolutely. This was, I thought, a fascinating study. Almost 5,000 patients with a symptomatic pulmonary embolism randomized to either oral rivaroxaban, a factor Xa inhibitor, or the regimen many people use, enoxaparin, a low molecular weight heparin transitioning to a vitamin K antagonist. And the primary endpoint was one of non-inferiority, and that was met. So statistically speaking, one can say the oral regimen of rivaroxaban is non-inferior or approximately as good as the more conventional regimen using parenteral to oral anticoagulation. But I think the more interesting finding was that major bleeding was cut in half by the approach with rivaroxaban, or major bleeding reduced from about 2% to 1% over the course of 30 days. And to me, in a practical sense, that really is a big advance.
That's a big thing. Peter?
Well, the trial is also interesting in that the separation of the curves for bleeding is very early. And what that means to me is if you really anticoagulate somebody with enoxaparin to start with, that they bleed early, and the rivaroxaban tends simply not to do that to you. And I rather like this drug that it sort of rolls off your tongue, doesn't it? Rivaroxaban. And so it's a nice thing, and Rivarox is easy to remember. But this drug for orthopedic procedures has already shown its worth.
Right.
And now we're seeing it for DVT and pulmonary embolism in general. And I think this drug has a promising future.
Yeah, absolutely, and it's oral, so that's an advantage just in terms of convenience. And there are other data sets too. Atrial fibrillation, the data looks pretty good with respect to warfarin, was non-inferior there as well, superior in a sort of on-treatment analysis, but the primary analysis was non-inferior. And some data even in acute coronary syndromes, no indication there, but the Atlas II data showing with a different dose, a very low dose of this drug, a reduction in all-cause mortality.
And it's once a day.
Depending on the indication, once a day.
Yeah.
Right.
So very promising look
I think so.
at an oral anticoagulant. Peter, another study that caught your attention?
The big study today is the partner follow-up business, and this is partner 1A. Now that's the randomized partner trial against surgery, the high-risk patients, transapical or transfemoral versus standard aortic valve replacement. Now 2 years follow-up, and actually in many patients a little longer than that. The bottom line here is that ho-hum, as anticipated, yes, mortality continues to be the same, no difference between surgery and transcatheter replacement. Mortality and stroke, no difference once you get past the early time, right, and so forth and so on. And everything's sort of going along saying, well, boring, 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 everything continues to be about the same. And then they talked about paravalvular leak. And in the beginning, when we looked at all of this, we said paravalvular leak was present in about 80% of patients. Not very many had terrible paravalvular leak, and it didn't seem to make any difference to the ventricle. Not true.
Right.
So the new data that have come out today show that if you have paravalvular leak, particularly moderate or severe, you are headed for trouble. And this is a reflection of what the European data has already shown us. And that's good news in that it's supported by what the Europeans have told us. And it also tells us that we need to begin to evolve this procedure in the United States. In Europe, they already have larger valves, different tricks that we can't
knowing
use.
Where the calcium is, where it sits, and all that.
That's also helpful. Measuring the annulus a little bit more accurately becomes a big issue. So I think what I get from these data today is, number one, it's sort of a stop short and think again. And number two, we need to reconsider how we deal with some of the ongoing problems of paravalvular leak. Maybe we should think about redilating more. Maybe we should be a little more careful about measuring the annulus. But this is an important issue going forward that we're going to have to address. New valves, the second generation valves, may actually be better at paravalvular leak than the present ones. We'll see.
Deepak?
Yeah, I agree with all of that. I was actually pretty excited even by the part that Peter thought was ho-hum. That is, the durability, to me, is impressive. So I think this really is a leap in medical technology and innovation. But having said that, these paravalvular leaks are of some concern, and it shows that we do need better technology, iterative improvement in technology, and better technique. with more research leading to that
It's,
better
you know, it's
technique.
not surprising that the AI does poorly, because these are thick ventricles that are used to pressure volume, and all of a sudden they get an AI
And we all
volume. They
said,
don't like that.
yeah, we all said at the beginning, this can't be good, and then it seemed to be good, and now it turns out that it can't be good.
I'm sorry, you were going to say
So one
something.
last thing, and that is that the really good stuff about this is the valves are not deteriorating.
That's
Valve
what-
area remains exactly the same. Valve gradients remain exactly the same over 2 years. So the valves seem to be at least holding up. That's good news.
So where do you think we're going? I mean, obviously it has to do with design of valves. It has to do with placement of valves. I mean, where do we go from this data?
I think that what we learn is that we're doing the right thing. This is breakthrough technology, no question.
absolutely.
We just need to deal with now the fine tuning of the technique so that we minimize paravalve air leak. Stroke does not seem to be an ongoing issue. And as we go forward, we'll just get better at this.
Deepak, where do you?
PERC valves are here to stay. This is a big deal. It's not just hype. I think the durability is really impressive, and it's only going to get better with newer generations of technology.
Absolutely. Well, great comments from both of you, and thank you for joining us. We ask you to stay tuned because we'll have a lot more from ACC 12.